The state of Kansas currently has a shortage of family doctors, especially in rural areas, and it's only getting worse. The University of Kansas is trying to turn that around. Here at KU Med's Wichita campus, they're working hard to encourage more graduates to eventually practice in smaller communities.
Hi Terry, how are you doing today?
Good.
Dr. Jennifer Bacani McKenney can't go anywhere in Fredonia, Kansas without running into someone she knows. She grew up in this southeast Kansas town of around 2,400 people, then left to go to medical school at KU. After meeting her husband, she had no plans to return.
We thought, well, we're gonna go somewhere cool. We're gonna go to Colorado, we're gonna ski every weekend, we're gonna go to Montana and hike and everything else, you know.
Then something happened. The people of Fredonia changed her mind.
Once I got halfway through residency, I told my mom and my dad that, well, I don't know if we're gonna come to Fredonia. And so all of a sudden then we get we get bombarded with all of these letters from people in Fredonia saying, we would love for you to come to Fredonia. We want you to be our doctor here. Maybe take a listen to your heart again. Is that okay? Or should we?
That included a letter from Susan John, who is now one of McKenney's patients.
Just to let her know that, you know, while everybody knows your business, they also help you in your business.
John is also the director of Fredonia's Chamber of Commerce and feels the pressure of trying to recruit doctors to a small community. Without local doctors, they run the risk of watching their town wither away.
Having young doctors come to our town, it gives us a lot of benefit in potential growth, and that's what we're looking for.
John has a lot of competition from other small communities when it comes to recruiting physicians. More than half of Kansas's counties are considered medically underserved. There just aren't enough doctors to go around.
We've done a very good job, I think, of trying to encourage physicians going to rural areas. The problem is we just don't have enough to supply the need for the entire state of Kansas. As we've seen decreased tax support for our medical schools, is our tuition levels for medical schools has gone up and up and up. And this puts a real burden on our medical students, particularly those medical students who want to go into primary care. Our medical students are very smart, they can do the math, and they can also see what they're going to earn as a primary care physician or as a family physician, and then the other opportunities and other specialties.
KU is currently second in the nation when it comes to the number of graduates going into family medicine and has several programs aimed at addressing the shortage. 2 of them are funded by the Kansas legislature. First, full medical school loan reimbursement for 30 students per year who commit to practicing in a rural community. Second, a bridge stipend for 7 medical residents per year to help them better connect to the small community they plan to serve. All KU medical students are also required to do a 4-week rotation in a rural community during their 4th year of school.
I can tell you that every medical student that comes back from their rural rotation says this is the best rotation that they had in medical school.
Despite all these efforts, KU will need to keep coming up with recruitment ideas. It's estimated that 20 to 40 Kansas family physicians will retire every year starting now. That's a gap not easily filled from graduating classes of around 160 to 190 total medical students.
I think that we have a lot of medical students that go to medical school wanting to go to rural areas. Oftentimes they come from rural areas and their goal is to go back. But there is something about medical education. It's oftentimes in larger cities, it's oftentimes in tertiary care centers and large hospitals where we have lots of subspecialists that for various reasons dissuades them from going back to a rural area.
McKenney's father is a surgeon in Fredonia and says the future of the regional hospital there depends upon bringing new doctors in to replace those who retire. He says he was thrilled when his daughter decided to come back home.
Well, when she came, gave me new life to, and I love working with her.
McKenney is also starting to realize just how much the town depends on her.
With 5 doctors in our community, we're already busier than we would expect to be. So if you have more patients out there and less doctors, it's only going to get worse. And unfortunately, it's worse for the patients because they'll have to wait longer for their medical care, or they may not be seen at all. We can't make that worse. We can't let that happen to people.
People she cares for every day, in a job she now can't imagine doing anywhere else.
I tell every single medical student and every resident that I love what I do today, and it's better than anything I even imagined it would be. And that's because of the personal relationships with my patients.
Up next on Inside KU, we'll meet the Executive Vice Chancellor of KU's Medical Center and talk about some exciting new developments there.